Everyone, let's read the scientific paper together. The title of this article is SACROLF, IMA A, MDNM, PICO F, Remote Ischemic Conditioning in Ischemic Stroke and Myocardial Infarction, Similarities and Differences. Frontiers in Neurology, 2021, 12:716316. Hello everyone. Today I want to talk about a medical technique that sounds very professional, but is actually quite simple in principle. It's called remote ischemic conditioning, or RIC for short. This method is mainly used for two common and dangerous conditions: myocardial infarction, heart attack, and stroke. Why do we need this method? Both heart attacks and strokes happen because blood vessels suddenly get blocked, stopping blood flow. This causes tissues to be deprived of oxygen and nutrients, eventually leading to cell death. Although there are many ways to reopen blocked vessels, such as using cardiac catheterization for heart attacks or thrombolytic drugs and mechanical thrombectomy for strokes, even after restoring blood flow, patients can still suffer disabilities or die. Why is that? Because the process of restoring blood flow can cause a side effect called reperfusion injury. Simply put, when blood returns, it can bring inflammation and free radicals that damage cells that might otherwise have been saved. Doctors have been searching for ways to protect tissues, extend the critical rescue window, and reduce reperfusion damage. This is where RIC comes in. So what is RIC? The procedure is quite simple. A blood pressure cuff is placed on the patient's arm and repeatedly inflated and deflated to temporarily restrict and then restore blood flow in that area. It might sound strange. Why restrict blood flow to the arm? Because this triggers the body to produce protective signals or substances that travel through the blood or nerves to the heart or brain, making these vital organs more resistant to actual ischemic events. It's like giving the body a small training session so that when a real emergency occurs, it can better withstand the stress. The three methods of RIC. RIC can be categorized into three types. 1. Preconditioning, performed before ischemia occurs. For example, if a patient is scheduled for heart surgery, RIC is applied beforehand to prepare the body. 2. Perconditioning, done during the ischemic event. For instance, when a patient arrives at the emergency room experiencing a stroke or heart attack, RIC is initiated immediately. 3. Post-conditioning, applied after blood flow has been restored. This helps reduce the side effects of reperfusion. How does it provide protection? Scientists have identified several possible mechanisms. Protective substances in the blood, such as certain proteins and hormones, travel through the bloodstream to the heart or brain. Neural signaling. Nerves in the limbs transmit the ischemia signal to the brain or heart, triggering protective responses. Immune system regulation reduces inflammation and decreases cell death. Improved blood flow increases substances like nitric oxide, which dilate blood vessels and enhance circulation. Mitochondrial protection lowers free radical production, preventing damage to the cell's energy factories. Research findings in heart disease. In patients with myocardial infarction, studies on RIC have shown a reduction in markers of heart damage, such as cardiac enzymes. Some studies indicate a smaller area of heart tissue affected by the infarction. Research findings in stroke. In stroke patients, animal studies have been very successful, showing reduced brain infarct size and better functional recovery. Human studies suggest RIC can lower inflammation markers and improve cerebral blood flow. Future prospects. Future research may focus on identifying which patients benefit most from RIC, optimizing RIC protocols, frequency, duration, pressure, combining RIC with other treatments to see if it can truly improve patients' quality of life. Summary. The heart conditioning method called RIC involves simple repeated arm compressions to activate the body's protective mechanisms. Research in heart disease and stroke shows some benefits, but more clinical evidence is needed. Although it is not yet a standard treatment, its safety, low cost, and ease of use suggest it could become an important tool for emergency care or prevention in the future. If RIC becomes widely adopted, it may help more patients with heart disease and stroke. Thank you for watching. Do people truly believe that healthy medicine and RIC can promote wellness? Hurry and purchase a healthy RIC sphygmomanometer to enhance your health every day. Don't forget to scan the QR code. Thank you all for watching. I am Dr. Andrew Shu Lee. Until next time.